Hi, Dr. Staci Avakian here. We're at Back Pain Relief Center in Vineland, New Jersey. We're here today with Colleen. She comes in every so often, depending on whatever's bothering her at the time. Today she's here because her head is actually bothering her. She's got a little bit of a headache and down into her upper neck. She started doing a new and different exercise. Sometimes when we do new and different things fall apart a little bit. So we're just going to try and put her back together, get rid of some of the spasm, and get her joints all lined up again so that she can get back at it tomorrow. Lower back's good?
No, that was hurting a little today.
Oh, okay. Yeah, it's a little off on the right side, actually.
That's where it hurt.
Okay. Yeah, you kind of feel that right away. Colleen is also a barber, so she stands a lot. And she does tend to get a lot of neck discomfort from having her arms out all day long and standing in one spot all day long. So Colleen does not love cracking adjustments, and so she gets a lot of relief with the instrument that I use. And you'll see, are you okay being face up? We can do your back to the camera. And so after I do this part, we'll have her sit up, and you can see I do some range of motion stuff with her neck. Helps loosen it up and relieve some of the tension and create movement. Good. Okay. Any knee? Good. Okay, so if you don't come up, if you don't want to face the camera, you can just face this, spin this. Okay, so with barbering and stuff, sometimes you can get a little bit of a forward head posture, these muscles spasm, the muscles over the shoulder spasm. So I'll be bringing your shoulder blades back. And then we just kind of get in there and try to create motion in all the areas that are stuck and tight and spasmed, and that helps to relax the muscles. Also stimulates more proper posture and muscle relaxation on a neurological level or a cellular level. Good. So now we just work to get make sure all the ranges of motion are normal. Alright. And so she'll let me know if she starts to get lightheaded or anything. Sometimes people do a little bit. Just a little bit. There you go. Shoulders back again. And we're just going to come all the way down. And then because she actually complained of a headache, this is just a little headache protocol that I do sometimes. Just works on the right spots of the skull, and the muscle insertions. Gets the blood flowing more normal. Is that alright? Mm-hmm. And so then that's it. That's Colleen's adjustment for today. Dr. Staci Avakian, Back Pain Relief Center in Vineland.